Welcome back to the Lovin Dubai show. Today we are joined by Dr. Arif Khan, who is the founder of the Strategic Development of Neuropedia, the first comprehensive children's neuroscience centre in the region. Good morning. How are you? Welcome to the show.
Morning. Thank you so much for having me on the show. It's an early morning, but I think a good time to start.
I agree. I'm looking forward to get into it. We put some questions on our social media yesterday. We asked some parents if they had any questions for you. So we'll get to those later in the show. But first of all, a little bit background about you. How long have you worked in, children's development for?
I would say now coming close to 16 years.
The diagnosis of autism in different ways.
And you being scared is
absolutely a normal reaction that we see with most of the parents that we come across. Right. Please remember that you need to give yourself some time to come to terms with it.
It's what I call the new age clinic, where we cater to just one thing, which is children's brain. So we cover children's neurological conditions, their psychological conditions, behavioral, as well as neurodevelopmental conditions and rehabilitation. So we have specialists like neurologists, psychologists, physiotherapists, speech therapists, occupational therapists, educational psychologists, dietitians, and we have programs to develop children's attention, their concentration, and so forth. So anything to do with children's brain, we provide those services in Neuropedia. But having said that, I'm currently at King's College Hospital. I provide services to them. So this is not Neuropedia, this is King's College.
Okay. And for example, what type of treatments are we talking? What type of scares are parents looking at that they may be reaching out to you for? What's a kind of a common treatment that you're working with parents on?
Sure. I mean, the most common conditions that we come across are autism. For example, I'm sure everybody have heard of a condition called autism. It's pretty rampant. About 2%, close to 2% of kids suffer from autism. And then there is ADHD, epilepsy, cerebral palsy, just, regular headaches, migraines, children with congenital or genetic brain disorders, children with spasticity, dystonia, and it goes on. Anything, and because brain controls your entire body, many of the conditions that we come across have an underlying cause within the brain. And that's what we deal with. We have an interdisciplinary team, and that was the main ethos behind starting Neuropedia. Because we had, hospitals, for example, you would find a pediatric neurologist in a hospital, but to have a team under one roof is something that we had a vision of, and that's why we brought all the specialists together to develop this team within an umbrella called Neuropedia.
Well, what I was going to say is, why is this needed? So we're saying it's the first comprehensive neuroscience centre in the region. Why was it needed, and was there a massive need for it?
Yeah, there was none. And that's the reason Neuropedia is the first neuroscience center in UAE. And we cater just not to UAE, to Gulf region around UAE. And we have these specialists in different areas. So within rehabilitation centers, within hospitals and clinics, but we didn't have a single center that brings all these specialists together. So now a patient or a child just needs to enter Neuropedia to get all these expertise under one roof. And that was the main ethos behind this.
Which is amazing for parents, I'm sure. You mentioned autism, and let's talk a little bit about, do you work with schools, for example? If you said 2% of, that's 2% of, is it children, of people have autism. So therefore, how are we looking at kind of the general, okay, so for example, if a parent is concerned, if they come and visit you, do you work with schools, for example? Do you work with schools to make sure that kids are looked after?
Yeah, so it starts off, there are two parts to it. There is the diagnostic aspect, and there is the intervention or therapeutic aspect. So the diagnostic aspect starts with either a child neurologist like myself or a child psychiatrist. And we do an initial assessment, we do medical testing, we do observational assessments for children, we take help from our psychologist and behavioral therapist, and we come to a final diagnosis. Now, if a child eventually has a diagnosis of autistic spectrum disorder, we have to get a team in place. And the team includes behavioral therapist, speech therapist, occupational therapist, and of course, a big part is played by the academic environment, which is school. And if this child is going to a mainstream school, we make sure that these services are provided within the schools. We cater to many schools around the region, like GEMS Metropole being one, where we have a specialized transition classroom called Unity there, where it's a stepping stone for these children to develop their skills before they jump into a mainstream classroom. So we are working with a number of schools, not just GEMS Metropole, to develop this transitional kind of phase before they jump into a mainstream classroom. Or, to put it in simple words, preparing these children to develop the skills needed to move ahead.
How have you seen, I guess, schools' development of facilities for kids with special needs grow over the years? Have you seen massive progress?
Yeah, I mean, that all comes under this, the terminology called inclusion. And we have, the government of Dubai or the government of UAE as a whole has done immense work to establish inclusion within pretty much every school in Dubai. Some of the schools have better provisions, some not so much. They're trying to catch up. But now every school has this kind of underlying principle, but they have to make sure that they have inclusion as a part of their vision or mission within the organization. And yes, it has developed. I've been in the country for 6 years, but I did my initial schooling in Dubai as a young, year 1, year 2 student. I was here in the 70s and 80s. And then the concept didn't exist. But coming on in the last 10 years, it just exploded. And probably Dubai is an example for many other cities and countries, how inclusion needs to be kind of adhered to, and the academic and the therapeutic aspect of the child's needs are brought together.
And how can parents decide on the right schooling or potentially the right placement if their child has special needs?
Yeah, the first thing is acceptance. So once parents know that there is a deficit or a child is not meeting the required skills, they bring this to the attention of the school authorities, or sometimes the school pick it up. It's seen by someone called SENCO, that's a specialized educational needs coordinator, which every school has. And the SENCO then drives the children out for assessments. So they see educational psychologists and these various specialists like speech and occupational therapists, a neurologist, to get to an overall diagnosis and a strategy plan. And then what is developed is an IEP, or individualized educational program, which is kind of tailored to that particular child to bring out the best in that child, keeping in mind the areas that the therapists have to work on. So IEP is the key that we drive through. Yeah.
The work you're doing is fabulous, but what sort of reservations might parents have when it comes to a lot of assessments and a lot of treatment? Do you see reservations among parents?
Yeah, there are two areas that we've already addressed this before, and we were trying to kind of overcome these hurdles. One is stigma. So it takes a lot of time for parents to accept a diagnosis. And I, through my social media platforms and Neuropedia's websites and social media platforms, try to drill this into parents that it is not a stigma. It is something that it's like a cold and a cough your child has. You would take your child to a doctor. Similarly, with this, if you find a deficit or a skill deficit in a child, at least get an assessment done, because there's no point hiding under it and saying, okay, there's nothing wrong. There's nothing wrong in getting a diagnosis or an assessment and starting the intervention early, because we know the best time an intervention helps a child is between 2 to 4 years of age, which is when the brain grows really rapidly. And that's what we need to utilize. So first thing is the stigma. Once we overcome that, the next step is the financial side of things, because these assessments and these therapeutic interventions are expensive. And sometimes parents cannot afford that. And therefore, we have put certain aspects in place where we have subsidized rates for parents. Schools help out in certain areas. We have certain charities that we reach out to, and we try to incorporate these children within the overall academic plan that we make for the child.
You mentioned looking out for early signs and removing the stigma and then just being aware. So as a parent, what signs would I be looking for that may be of concern?
That's a very broad question as such. So if you just talk about autism, for example, which forms a big chunk of what we do, early signs of speech delay. So a 1-year-old or 18-month-old child unable to communicate through words. There are no gestures, social deficits. The child doesn't maintain eye contact, doesn't respond to his or her name, doesn't turn to his or her name, doesn't point at objects that he or she wants, cannot communicate his or her demand to parents. A lot of behavior which is kind of it's different from what you see within the normal or neurotypical children. And these are the first few signs that parents can pick up and get an assessment done in a center like Neuropedia to then go ahead to develop an individualized plan for the child.
There's a lot of stories in the media about adults finding out that they have autism. So it's very possible to, live a normal life and have autism. So what are the treatments that you would be kind of starting at from an early age that would make a difference to a child's life?
I mean, as I said, between 2 and 4 years of age is the time where you can push and drill in interventions so you can bring about the best possible improvement. And I always kind of advocate this, that we shouldn't try and cure or treat or change your child. That's not the kind of principle behind treatment or of autism. What we try and do is we try and incorporate certain skills within the child so that he or she can live in a society and a world that we have created and the norms that we have built. And sometimes we need to change the way we carry out our academic institutions or something like that to adapt them within that environment. So it's not about cure or treatment, especially with autism. It's about adaptation. And that's something that when I see parents for the first time and a diagnosis is made, I sit down with them and explain to them that don't look for changing your child. Don't look for normality. It doesn't exist. A child with autism has slightly different wiring. It's like they are, say, an Apple or a Mac OS as opposed to us working on a Windows. So we are both softwares in our own right, working through the world. But the problem is the world cannot cater to their software. And that's what we need to do, is change ourselves.
Understood. We asked, like I said, we put the question out on social, and a lot of people's questions were related to migraines and headaches in children. So the first question we got in was, are migraines hereditary, and can they start from 10 years old?
Of course. I mean, the youngest child I had with migraine was 18 months old. So yes, they can start in young age. At 18 months, you would say, how would they tell you? We didn't know, because the 18-month-old cannot communicate their symptoms. So this child was just crying all the time, and we did various diagnoses, then dug deep into the familial history, and we picked up that there's a strong familial migraine history, and that's how we picked up the diagnosis in the child. And after treatment, it went away. So yes, migraine does occur in children. I see at least 3 to 4 patients every day with migraine who are less than 10 years of age. And yes, it does run in families, but it is not a disorder where 50% of your children will have migraine if I have it. No, it's not that. But it's more likely that you will have migraine if your parents or your grandparents had migraine. So it's familial. That's the terminology we use for migraine. Yeah.
The next question is, my baby vomits when I give her vitamin D. What should I do?
It probably is not vitamin D. It's what the vitamin D is made up of, or the taste of the vitamin D, or the texture of the vitamin D supplementation. So if you change the texture, like instead of syrup, you give a tablet or a capsule, or you change the brand itself, to sort the problem out.
Why does my 5-year-old keep complaining about headaches on the left side of her temple?
Oh, it could be a number of reasons. So if you have a persistent chronic headache in a 5-year-old, you have to get them checked. And the most important thing is get their eyes checked, because that's something that gets ignored most of the time. And you correct their vision with a pair of glasses and things just sort out. But having said that, any serious illnesses, like whether it is a brain problem or increased pressure in the head, that needs to be looked at by a neurologist. So get her checked.
And finally, this is my own personal question. My boyfriend has severe migraines, and he has had since he was a teenager, since early years. They're debilitating. I've never seen someone so affected by a migraine. They come on, they take like a day or two, and then they really just wipe him out physically. What can be done?
I mean, the treatment of migraine, you can divide it into 2, depending upon the frequency of the migraine, that is how often it comes, and the intensity of the migraine, that if it's not frequent, is it very severe? So, and based on that, there are 2 forms of treatment. You give prophylactic treatment, which is you take a medication on a daily basis to reduce the frequency of the headaches. Or if your headaches are not frequent, the migraines are happening once a month, you take something to reduce the intensity, that is called symptomatic treatment. And for example, I don't know whether your boyfriend is someone who has it on a monthly basis or weekly, but if it's monthly, once a month, so it's symptomatic treatment. So they take imigrants, for example. These are specific migraine-related symptomatic treatments that can be just popped into the mouth just when the headache starts. It reduces the intensity and the length of the headache.
Thank you so much. That has been very insightful, but I'm sure we've only kind of covered the tip of the iceberg. This was Dr. Arif Khan, who is the founder of Strategic Development of Neuropedia, the first comprehensive children's neuroscience centre in the region. If people would like to reach out to you, if I'm sure there's parents watching, if they have questions, how can they do so?
Absolutely. I mean, I'm on social media anyway, so it's at dr.arif.khan. They can send out a message through that. It might take me a few days because, you know, that is not a clinical platform, but they can reach out. They can call up 343-1113. That's the phone number for Neuropedia. And if they want to see me directly, they could book an appointment, or they could come over to King's College Hospital.
Perfect. We really, really appreciate your time this morning. Thank you so, so much. And that was very insightful. Guys, that's it for us on the show. Bye-bye.
Thank you for having me. Bye-bye.